Hello, welcome to the channel. Today we want to look at how drugs can transfer across the placenta barrier, and we want to look at some chemicals that are described as teratogens that can cause malformation in fetus. So let's get into that. Don't forget to subscribe to the channel and like the page. So the placenta is the link between the mother and the developing fetus. It is where nutrients are exchanged. It is where substances are exchanged. It also serves as a good barrier to content from the mother and the blood, to the extent that the blood of the fetus and the blood of the mother do not directly mix. This is a very good barrier. But the placenta is not a perfect barrier. Even though it serves as a barrier to drugs and chemicals administered to the pregnant woman, there are times that some drugs, some chemicals do cross the placenta. Now, when they cross the placenta, they can be harmful or they can be helpful. So on one hand, placental transfer of drugs can come with a potential for great harm to the fetus. A typical example is the thalidomide tragedy, where pregnant women were given thalidomide to help their nausea vomiting, and it ended up causing havoc for these fetuses born without arms and with shortened arms, what is called phocomelia. On the other hand, sometimes fetal conditions like fetal arrhythmia, congestive heart failure, may be managed when mothers are given the medication, when the mother is administered the medicine that the child would need to help manage it in the womb. And for that to happen, that drug must also cross the placenta barrier. So, depending on what the effect is, placental transfer of drug could be helpful or could be harmful. So if we take a typical example of a drug like fentanyl, which can be used during labor as a pain reliever, as an opioid. Now here we see our child in the womb and we take the barrier out. So now we see a maternal blood, we see the fetal blood, and they do not mix. This is where the barrier is. So this is our placental barrier. Now, fentanyl, which is an opioid and it is lipid soluble, can readily cross this placenta. So when given, it crosses the placenta to the fetus. Now, unfortunately, when it travels along the umbilical veins and reaches the fetal circulation, it can cause respiratory depression, which can lead to the death of a child, especially if it is given right before labor. So then you have to be cautious when you have to give fentanyl as a pain reliever for your pregnant or laboring mother. But the point here is simply that some drugs can cross the placenta barrier and can be helpful or can be detrimental to the developing fetus. Now, here are some factors that may affect the ability of a drug to cross the placenta. So it depends on the physical chemical properties of the drug. The more lipid soluble the drug, the easier it is for the drug to cross by simple diffusion. Also, the molecular size. the smaller the drug, the easier it is to cross. Protein binding, the ability of the drug to bind to protein, may deter its crossing, or drug that does not bind well may promote its crossing. All drugs come in acidic or basic form mostly, so the pH of the drug and the pH environment of the placental region can promote the ability of the drug to cross. How long the drug is exposed at the placental barrier site can also determine the ability of the drug to transfer or to cross. So factors that allow the drug to cross could include drug factors. Then factors like the host factors. Now, in this case, what is the stage of the development of the fetus and of the placenta when the drug was exposed? How much of the drug concentrations was exposed to reach the fetus? What is the blood flow at that site? So these factors all may affect the placental transfer of drugs. The transfer follows the normal transportation of drug substances across cells. So it could include the passive transportation systems, could include the active transportation systems. For example, it could be an active transport, it could be a facilitated transport, it could be a simple diffusion, it could be a passive diffusion. All of these are ways by which drugs can be transferred across, and there's no difference when it comes to the placenta. So the knowledge that drugs can transfer across the placenta brings us to a very important point, and that is caution when giving drugs to a pregnant woman because of the ability to cross and to either harm the fetus or to cause malformation in the fetus. Now, with that idea, now let's look at how some chemical substances or drugs, once they cross, can cause malformation in the developing fetus. This process, the creation of malformation, is referred to as teratogenesis. So teratogenesis is the creation of a deformed organism, and it could be precipitated by what is known as a teratogen, a chemical substance or agent, and that could include drugs, which, when exposed to the fetus, can induce a malformation, especially in the first trimester of the fetal development. Now, these teratogens can actually cause immediate effects, or sometimes the effect can be observed at birth. And even sometimes the effect can be delayed and shown later in life. Cancers, for example, occurring. So, where a drug substance or a chemical substance is exposed to mother and results in malformation in the child, we call that chemical substance a teratogen. So thalidomide, as we mentioned earlier, which resulted in these malformations, was an example of a teratogen. And when our mothers took thalidomide in those days, this is what resulted in some babies, these malformations, also known as phocomelia. We know that during the development stages of pregnancy, the first trimester, the early period of pregnancy where there is a lot of structures being formed, is usually where it is more easy to get development of these teratogens. Development of the malformation when exposure to teratogens occur. There are some principles that are used as guidelines to teratogens. So in teratology, where you are studying teratogens and their effects, it's been found that teratogens act with specificity. That means teratogens give a specific abnormality or constellation of abnormalities, group of abnormalities. So thalidomide is known to cause phocomelia. Valproic acid is known to cause neural tube defects such as spina bifida or anencephaly. Now, it is always specific, and so we can tell sometimes which medication we gave that caused, or which chemical caused the particular malformation. That's also why you can advise to avoid certain chemicals because they have been demonstrated to cause specific malformations. The second principle is that teratogens demonstrate a dose-effect relationship, meaning the more sufficient concentrations of the teratogen that reaches the fetus, the more the effect could be seen. So teratogens, they must reach a specific or sufficient concentration or amount to be able to cause the effect. That means at lower concentrations, these teratogens may not cause the effect, but at higher concentrations, then they can do that. And also, the effect a teratogenic agent can give or have on a developing fetus depends on the stage of the development of the developing fetus. And this is why the first trimester is the most prone trimester for such development of malformations. Now, here is some malformations that have been observed with the use of some medications. So, phocomelia, as we mentioned, now these are examples of the neural tube defects that we also mentioned. For example, when valproic acid is used. This is anencephaly. This is open spina bifida. So various types. But basically, for neural tube defect, it has to do with a defect on the brain or the spinal cord during the development of the fetus. And we've seen that drugs can precipitate that. There are two main mechanisms that have been illustrated as causing malformation in development of children. One, it could be an error in genetic programming. Now, this one is usually very, very low probability because hardly does the body make such mistakes. It can happen where there is a deviation in the genotype of the embryo, or there is error in the coding of a normal genotype. This can occur, but this is rare. However, environmental agent or factors can precipitate, can interact with the embryo during its development and cause such malformations. So it is the environmental insults that actually leads more to these teratogenesis in our babies. So examples of substances and chemicals include drugs, chemicals, radiations, infections, even hyperthemia, and abdominal maternal states. Now, these environmental factors or agents have been known to cause genetic interference where then they will initiate the error in genetic programming. They cause genetic mutations, chromosomal breakages. They can interfere with cellular function and they can inhibit enzymes, or even some membrane characteristics can be altered. Now, once the developing embryo is exposed to an environmental agent or factor, an insult, that can result in that failure of the cell-to-cell interaction which is needed for the development. Then it will result in the malformation. It can also interfere with cell migration, or it can be a disruption, a mechanical disruption of cellular activity. And that is how environmental factors are able to precipitate malformation in the children, developing fetus. So let's look at some examples of teratogens and the teratogenic effects that they have been associated. So we've mentioned thalidomide causing phocomelia. It can also cause multiple defects. Androgens have been associated with virilization, where we can see in this picture muscularization, the lady with so much hair because they were given androgens, or it could be a man. You can also have limb and esophageal or cardiac defects with the use of androgens. Same way use of progestins can cause feminilization and virilization of a female fetus. Now, the drug methotrexate, which is used for cancer, have been known to cause cleft palates, hydrocephalus, and other multiple defects, sometimes even fetal death. Stilbestrol has been known to cause cancer, vaginal cancer, in our teenage females. The drug phenytoin has been shown or has been demonstrated to cause hypoplastic phalanges, which is where you have multiple or shortened phalanges, which has to do basically with the limbs. Cleft palate has also been demonstrated by phenytoin. Microcephaly has also been seen with phenytoin. Warfarin has demonstrated depressed nose, depressed eyes, and it has demonstrated hand defects, and for some children, growth retardation. Lithium has caused the defect of fetal goiter and other cardiac abnormalities, cardiac and other abnormalities. Phenobarbital has been associated with a constellation of malformations. Carbamazepine, neural tube defects and other abnormalities. Valproic sodium with spina bifida and other neural tube defects. Tetracyclines have been associated with discolored or deformed teeth, retarded bone growth. Alcohol has been associated with low IQ in baby, growth retardations, and fetal alcohol syndrome. ACE inhibitors like lisinopril has been associated with hypoplasia of organs, with growth retardation, and even fetal loss. The antithyroid drugs has been associated with fetal goiter and hypothyroidism. Indosit, aspirin, and other NSAIDs have been associated with premature closure of the ductus arteriosus. Isotretinoin with cranial, facial, heart, and CNS defect. So you note that there's the specificity. We can associate a particular chemical substance, in our case, drug, with a particular malformation. And that is the insult that we are talking about. So in picture 4 here are some of the craniofacial malformations that has occurred by the use of our medications. And in this case, isotretinoin, as we mentioned. So you see, the exposure of certain drug substances or chemicals to your child, to a pregnant woman, could precipitate and cause malformation in the developing fetus. And this is why the FDA has come out with categorization of drugs so that these drugs, we can be pre-informed about such effects, and we are also to help report to the FDA through the pharmacovigilance system that has been set up if we experience or see any of such developments. So this is where we'll bring the lesson to a close. The next time we meet, we will have another wonderful time in studying obstetric pharmacology. Once again, like the page, subscribe to the channel so that you can have notifications when new things are brought forth. Have a wonderful rest of the day. God bless.